discussion is going to be on the endocrine and metabolic systems, Chapter 8. Our course objectives are to describe in detail the interconnected nature of the endocrine system, describe the primary and secondary endocrine disorders, the nature of hormonal imbalance, and recognize red flags to report to the physical therapist, understand the etiology, treatment, and prognosis for diabetes mellitus types 1 and 2, understand the role of physical therapy and treatment of the patient with diabetes mellitus, describe the importance of fluid and electrolyte balance on the metabolism, and describe the signs and symptoms of common endocrine and metabolic diseases. Our question of the day is: a patient with hyperparathyroidism is being treated in an acute care setting. 2 days after the initiation of physical therapy, the patient complained of lower back pain. Which of the following could best explain the patient's presentation? A, multifidus strain, B, herniated disc, C, lumbar osteophytes, or D, vertebral fracture. Endocrine glands synthesize and release hormones. Hormones are chemical messengers carried by the bloodstream. They regulate specific functions in cells and organs. The endocrine collaborates with the nervous system to control and integrate body functions for homeostasis. The nervous system sends impulses through nerves, and the endocrine system sends messages in the form of hormones via the bloodstream. Hormonal effects are slower in onset, but last longer than neural effects. Hormonal effects can be either localized or affect all cells in the body. Functions of the endocrine system include differentiation of the reproductive system and the central nervous system of the developing fetus, stimulation of sequential growth and development during childhood and adolescence, coordination of male and female reproductive systems, maintenance of optimal internal environment throughout the lifespan, and initiation of corrective and adaptive responses when emergency demands occur. Adenohypophysis, or anterior pituitary, is one of 2 lobes of the pituitary gland. It regulates various bodily functions through hormone secretion. Neural pathways act like highways in the brain and connects the hypothalamus to the posterior pituitary, allowing direct control over both the anterior and posterior pituitary glands. The brain signals the posterior pituitary to release antidiuretic hormone, which regulates water balance, and oxytocin, which is involved in childbirth and bonding. The hypothalamus releases hormones that control the anterior pituitary. These hormones stimulate the pituitary to release hormones that affect organs like the adrenal cortex, the thyroid, and gonads. Disruption in hypothalamic pituitary function can result in too much or too little hormone secretion and may cause vision problems due to their location in the brain. A negative feedback system works like a thermostat. It triggers a response to bring hormone levels back to normal when they get too high or too low. A simple feedback example is if blood calcium drops, the parathyroid hormone is released to increase calcium levels. When calcium is high, the parathyroid secretion decreases. A complex feedback involves multiple hormones and organs working together in a chain reaction to maintain balance. Some key hormones from the hypothalamus include growth hormone releasing hormone, growth hormone inhibiting hormone, corticotropin releasing hormone, and thyrotropin releasing hormone, as well as gonadotropin releasing hormone, prolactin releasing hormone, and prolactin inhibiting hormone. The nervous system can influence the endocrine system, which is responsible for hormone regulation in the body. An example is how the hypothalamus, a part of the brain, communicates with the pituitary gland. The hypothalamus releases certain substances that either tell the pituitary gland to release hormones or to stop releasing them. The The anterior part of the pituitary gland then releases hormones that stimulate other glands in the body, like the thyroid, adrenal glands, and reproductive organs. When there are problems with releasing tropic or stimulating or effector hormones, or if the target tissues don't respond properly, it can lead to endocrine disorders. The anterior pituitary gland controls hormones like adrenocorticotropic hormone, which affects the adrenal gland, thyroid stimulating hormone, which influences the thyroid gland, growth hormone, prolactin, follicle stimulating hormone, and luteinizing hormone. The posterior pituitary gland controls hormones like oxytocin and antidiuretic hormone. Catecholamines are organic compounds that help the body respond to stress. They include epinephrine or adrenaline, norepinephrine, and dopamine. Catecholamines are released when the body faces stress, activating the sympathetic nervous system. Effects of catecholamines are increased heart rate and force of contraction by boosting blood pumped by the heart, narrowing of blood vessels, which raises blood pressure, increased blood sugar, which breaks down stored sugar in the liver and muscles, increasing glucose in the bloodstream, and boosting fat breakdown, which increases fatty acids in the blood. This helps to prepare the body for physical action in response to stress. Stressors triggering catecholamine release include exercise, temperature changes, and intense emotions like fear or excitement. Cortisol is a hormone released from the adrenal cortex. It helps regulate metabolism of proteins, carbohydrates, and fats, leading to increased blood glucose and lipid levels. Cortisol is crucial for survival under stress by assisting in vasoconstriction and providing energy for body tissues. It also dampens the body's inflammatory response to foreign agents. Other hormones include endorphins, which are natural pain-relieving hormones produced by the body in the central nervous system that help to modulate pain perception by raising the pain threshold and inducing sedation and euphoria. Growth hormone influences growth by affecting protein, carbohydrate, and lipid metabolism. Levels of growth hormone increase in response to various stressors like surgery, fever, or physical exercise. Prolactin stimulates breast tissue growth and milk production in mammals after childbirth. Its levels increase with certain stressors. Testosterone is a hormone that regulates male secondary sex characteristics and libido. Testosterone levels decrease after stressors like surgery or illness to conserve energy for protective responses. Simple feedback occurs when low levels of a substance trigger the release of a hormone to bring levels back to normal. A complex feedback involves multiple glands and a chain reaction of hormone signaling. The pituitary gland is a small gland at the base of the skull within the sphenoid bone. It is known as the master gland because it regulates other hormone-secreting glands in the body through its hormones and its connection to the hypothalamus. There is an anterior and posterior lobe. The anterior pituitary releases hormones like prolactin and human growth hormone. Human growth hormone promotes growth by increasing protein synthesis, fat breakdown, and decreasing carbohydrate use. Abnormal growth hormone secretion can lead to conditions like dwarfism or giantism, also known as acromegaly. The posterior pituitary receives neural stimulation, triggering the release of antidiuretic hormone and oxytocin. Antidiuretic hormone acts on the kidneys to promote water reabsorption, reducing urine output. Oxytocin stimulates uterine contractions during childbirth and milk ejection during breastfeeding. Anterior lobe disorders and their etiology include the posterior pituitary gland disorders that can be caused by tumors, loss of blood supply, or genetic disorders or trauma. Signs and symptoms vary depending on whether there's too much hyperfunction or too little hypofunction hormone secretion. Hyperpituitarism is when there's excessive hormone secretion, is known as acromegaly in adults or giantism in children due to excessive growth hormone. Giantism is overgrowth of long bones in children, and acromegaly increases the bone thickness and soft tissue enlargement in adults, which is caused by growth hormone secreting tumors. Cushing's disease is caused by a pituitary tumor that secretes too much ACTH, leading to excessive cortisol production by the adrenal glands. Symptoms include abnormal growth, menstrual irregularities, and overstimulation of target glands. Hypopituitarism is decreased or absent hormone secretion. It is a rare condition that can cause dwarfism. This leads to a deficiency in several hormones affecting growth and other body functions. Posterior lobe disorders include diabetes insipidus, which is a rare disorder due to lack of antidiuretic hormone. This can result from damage to the hypothalamus, neurohypophyseal tract, or the posterior pituitary gland. Without adequate antidiuretic hormone, the kidneys cannot properly absorb water, leading to excessive production of dilute urine. Symptoms include polydipsia or excessive thirst, nocturia, which is frequent urination at night, and dehydration due to water imbalance. Syndrome of inappropriate antidiuretic hormone is caused by excessive release of antidiuretic hormone, leading to water retention and fluid and electrolyte imbalance. It's often caused by factors like pituitary damage due to infection or trauma. The pathophysiology includes excessive antidiuretic hormone secretion, which leads to water retention, causing low sodium levels or hyponatremia. Symptoms include water retention, low sodium levels, also known as hyponatremia, and potential complications related to fluid imbalance. The thyroid's function is regulated by feedback from the hypothalamus and pituitary gland, as well as internal regulation within the thyroid itself. Factors such as genetic makeup, age, and sex play a significant role in thyroid disease susceptibility. Symptoms are often vague and nonspecific, leading to many undiagnosed cases. Iodine is essential for production of thyroid hormones, which regulate metabolism, protein synthesis, enzyme activity, and other vital functions. Hyperthyroidism is a condition where the thyroid gland produces excess thyroid hormones, leading to an accelerated metabolism and affecting nearly every system in the body. The most common cause is Graves' disease, which is an autoimmune disorder. It is more prevalent in women aged 20 to 40. Hyperthyroidism can result from immune system and genetic factors. Graves' disease, as mentioned, is often autoimmune, but specific risk factors are not always clear. Excess thyroid hormone increases metabolism, stimulates the sympathetic nervous system, and causes symptoms like tachycardia, increased blood flow, weight loss despite an increased appetite, sweating, tremors, and palpitations. Other symptoms may include exercise intolerance and reduced exercise capacity, elevated heart rate and blood pressure during exercise, proximal muscle weakness. If the heart rate exceeds 100 beats per minute, frequent monitoring of blood pressure and pulse is recommended. Other effects that can occur include a goiter, which is an enlargement of the thyroid, and potential complications like atrial fibrillation, congestive heart failure, and increased risk of heart attack. A goiter is an enlarged thyroid gland and can occur in both hypothyroidism and hyperthyroidism. It can be a result of lack of iodine or calcium or inflammation of the thyroid itself. With Graves' disease, as mentioned, is an autoimmune disorder affecting women more than men. Symptoms include a goiter, weight loss, and other symptoms like rapid heart rate, sweating, and tremors, as well as bulging eyes as seen in the bottom image. Hypothyroidism is a condition where the thyroid gland doesn't produce enough thyroid hormone, resulting in slowed metabolism. It is more common in women than men and often runs in families, but can be congenital, but most often diagnosed between 30 and 60 years old. There is primary and secondary hypothyroidism. Type 1 or primary, the thyroid gland itself is underactive. The pituitary gland releases more TSH, or thyroid stimulating hormone, to stimulate the thyroid, leading to elevated TSH levels. Type 2 or secondary, the pituitary gland fails to produce enough TSH to stimulate the thyroid. Symptoms can be subtle and include fatigue, sensitivity to cold, mild weight gain, forgetfulness, depression, dry skin and hair, and other symptoms such as bradycardia, reduced gastrointestinal movement, decreased fat metabolism, dry skin, edema, and muscle weakness, especially near the body center. Clinical manifestations are listed here, as well as PTA implications such as monitoring exercise due to exercise intolerance, weakness, apathy, and myalgia, as well as decreased cardiac output. Parathyroid glands are 4 tiny glands located on the back of the thyroid gland. They produce parathyroid hormone, which regulates calcium and phosphorus levels in the body. Functions of parathyroid hormone include bone demineralization, which stimulates the release of calcium and phosphate from bones into the bloodstream, kidney function, with increased calcium absorption and phosphate excretion by the kidneys, and in the GI tract, it promotes the absorption of calcium in the GI tract. Problems with the parathyroid glands can lead to conditions affecting bones and joints. Conditions like periarthritis and tendinitis may occur due to calcium crystals forming around joints and tendons, leading to inflammation. Hyperparathyroidism occurs when one or more of the parathyroid glands becomes overactive, leading to disruption in calcium, phosphate, and bone metabolism. It is more common in women, especially after the age of 60. Primary cause of hyperthyroidism is the primary type of hyperthyroidism is caused by enlarged parathyroid glands, leading to increased parathyroid hormone secretion and high blood calcium levels. Secondary is due to overgrowth of the glands caused by malfunction in another organ system, often related to renal failure or vitamin D deficiency. And tertiary typically occurs in long-standing secondary hyperthyroidism, especially in dialysis patients. Here you can see clinical manifestations of hyperparathyroidism based on the body system, as well as PTA implications. One thing to note is these patients may be prone to fractures, have muscle weakness, and atrophy. So being careful with mobilization and weight-bearing activities is important, as well as exercise precautions. Hypoparathyroidism occurs when the parathyroid glands are accidentally removed or damaged during medical procedures such as thyroid or neck surgery. It results in low levels of parathyroid hormone, causing low blood calcium levels and high blood phosphate levels. Hypoparathyroidism can be acquired, such as resulting from accidental removal or damage to the parathyroid glands during surgery. Idiopathic causes, which occur without a known cause and is more common in children than adults, may have a genetic basis and could be related to autoimmune disorders like Graves' disease or Hashimoto's thyroiditis. The effects include hypocalcemia, and symptoms include muscle cramps, spasms, and neuromuscular irritability. High phosphate levels is when elevated phosphate levels can further worsen symptoms. Rare complications include calcifications in the brain and kidneys that may occur but are very rare in hypoparathyroidism. The adrenal glands are two small glands located on top of each kidney. Each gland consists of two main parts, the outer cortex and the inner medulla. The cortex function includes mineralocorticoids, which regulate fluid and mineral balance in the body, glucocorticoids, which control glucose metabolism and help manage the body's response to stress, and androgens, which produce sex hormones involved in reproductive health. The medulla's function include epinephrine and norepinephrine, which are hormones that affect vascular tone, including blood vessel constriction and relaxation, heart function by increasing the heart rate and output, nervous system activity by stimulating the fight or flight response, and glucose metabolism by increasing blood sugar for energy during stress. The adrenal glands help the body adapt to stress by releasing hormones. The cortex handles long-term stress responses such as energy balance and immune system regulation, and the medulla handles immediate stress response such as the fight or flight reaction. Addison's disease occurs when the adrenal glands fail to produce enough key hormones, especially cortisol and aldosterone. Addison's can be an autoimmune disorder where the immune system mistakenly attacks the adrenal glands. It can be caused by infections such as tuberculosis, which can damage the adrenal glands. In many cases, the exact cause is unknown. Other factors may include surgery, pregnancy complications, infections, injuries, or failure to take steroid therapy can trigger an acute adrenal insufficiency. Decreased cortisol and aldosterone production lead to metabolic disturbances and affects various bodily functions. Cortisol deficiency affects metabolism and reduces the body's ability to handle stress. Aldosterone deficiency disrupts sodium and potassium balance, leading to low blood pressure and dehydration. Symptoms include weakness and fatigue, low blood pressure, weight loss, nausea and vomiting, emotional disturbances like depression, and increased sensitivity to stress. When the adrenal glands aren't producing enough cortisol, the pituitary gland increases the release of adrenocorticotropic hormone in an attempt to stimulate cortisol production. Elevated ACTH levels also stimulate the production of melanocyte-stimulating hormone, which can cause hyperpigmentation, often leading to characteristic bronze skin appearance seen in individuals with Addison's disease. Aquatic therapy in hot and humid environments can pose risk for people with Addison's disease. The heat and humidity put additional stress on the body as they require higher cortisol levels to regulate body temperature and blood pressure. Since individuals with Addison's disease already have low cortisol levels, they may struggle to manage these additional stresses, resulting in symptoms such as weakness, exhaustion, low blood pressure, and difficulty handling stress. Aquatic therapy in these conditions can exacerbate these symptoms and lead to complications like dehydration, fainting, or severe fatigue, making it unsuitable for those with Addison's disease, especially in hot, humid setting. Cushing's syndrome is a condition that occurs when there is prolonged exposure to high levels of cortisol in the body. It can result from overproduction of cortisol by the adrenal glands, long-term use of corticosteroid medications, and overproduction of ACTH from other sources such as tumors. Cushing's disease is a specific type of Cushing syndrome caused by a pituitary tumor that produces excess ACTH, which in turn stimulates the adrenal glands to produce too much cortisol. Cortisol plays a role in metabolism regulation. It is essential for regulating glucose, protein, and fat metabolism. Cortisol helps maintain normal blood pressure by regulating fluid balance and vascular tone. And cortisol is a potent anti-inflammatory hormone that helps control the body's response to stress and injury. Excess cortisol can have several adverse effects, including muscle weakness and tissue damage. Excess cortisol in Cushing syndrome accelerates the breakdown of muscle proteins, leading to muscle weakness and atrophy. This is due to the increased release of amino acids from muscle tissue to fuel other metabolic processes. The body's response to excess cortisol involves catabolism, or breaking down of tissues, which leads to loss of soft tissues, especially in the areas of the arms and legs, making them appear thinner or weaker. Other symptoms of Cushing syndrome include protuberant abdomen, a characteristic moon phase, and a bulging abdomen can develop as fat redistributes, especially around the central body area. The skin becomes thinner and more fragile, resulting in easily stretched skin, which causes purple or red stretch marks. Due to cortisol suppression of the immune system and reduced collagen production, wound healing can be significantly slower. Skin becomes fragile, leading to easy bruising and cuts. Weakness often starts in the proximal muscles and may lead to difficulty with basic movements and daily tasks. Prolonged high cortisol levels disrupt bone metabolism, leading to a decrease in bone mineral density. This increases the risk of fractures, even with small trauma. In cases where Cushing syndrome remains untreated or is prolonged, there can be pathologic fractures, an increase in kyphosis, osteonecrosis, and bone and back pain. Beyond serving as an energy storage site, adipose tissue is classified as the largest endocrine organ in the body. It secretes hormones and signaling molecules that regulate various bodily processes. These include hormones such as leptin, adiponectin, and resistin, which influence energy balance, inflammation, and insulin sensitivity. Obesity is a chronic condition characterized by excessive body fat accumulation. It results from a combination of factors including genetics, hormonal imbalance, diet, and lifestyle choices such as physical activity. While lifestyle plays a significant role, obesity has strong biological components, making it difficult to manage for many individuals. Ghrelin is known as the hunger hormone. It is produced in the stomach and signals the brain when the body needs food. It stimulates appetite and increases food intake. Leptin is produced by fat cells. Leptin tells the brain when the body has enough energy stored. It plays a critical role in regulating hunger and energy balance. Leptin signals to the hypothalamus to reduce appetite when fat stores are sufficient. Low leptin levels can trigger hunger signals while high leptin levels typically decrease hunger. Obesity is associated with an increased risk of various cancers due to chronic inflammation, altered hormonal signaling, and other metabolic disruptions. In men, obesity is linked to a higher risk of cancer, such as colon and pancreatic cancer. And in women, obesity is associated with an increased risk of cancers such as uterine cancer and non-Hodgkin's lymphoma. The pancreas is located behind the stomach in the abdomen near the duodenum. It has dual functions, meaning it is both has endocrine function and exocrine function. The pancreas releases hormones like insulin and glucagon directly into the bloodstream, which regulate blood glucose levels, which is an endocrine function. Its exocrine function is because it also produces digestive enzymes that are released into the digestive tract to assist in the breakdown of food. The islets of Langerhans are specialized clusters of cells within the pancreas that are responsible for its endocrine function. The islets contain three major types of cells. Alpha cells produce glucagon, a hormone that raises blood glucose levels by stimulating the liver and other cells to release stored glucose. Beta cells produce insulin, a hormone that lowers blood glucose levels by facilitating the entry of glucose into cells for metabolism. And delta cells, which produce somatostatin, which is thought to regulate the release of both insulin and glucagon, helping maintain balance between the two. Normal blood sugar regulation. So after eating carbohydrates, they break down into glucose, which is the primary energy source for our cells, especially the brain. As glucose levels rise in the bloodstream after a meal, the pancreas releases insulin, that hormone that helps to regulate blood sugar. Insulin acts as a key to unlocking cells to allow glucose to enter from the bloodstream. This lowers blood glucose levels as glucose is either used for energy or stored in the liver and muscles for future use. As glucose moves into the cells, blood sugar levels return to a normal balanced state. When there is a drop in blood sugar between meals, the pancreas releases glucagon. Glucagon signals the liver to release stored glucose into the bloodstream to maintain blood sugar levels. Insulin and glucagon work together throughout the day to keep blood sugar levels stable, ensuring cells receive a steady supply of glucose for energy. Diabetes mellitus is a metabolic disorder where the body has high blood sugar levels due to problems with insulin secretion, insulin action, or both. The primary forms of diabetes include type 1, type 2, prediabetes, and gestational diabetes, each with distinct causes and management strategies. Type 1 diabetes is also known as insulin-dependent diabetes. Its cause is when there is an absolute deficiency of insulin production and secretion by the pancreas due to autoimmune destruction of insulin-producing beta cells. Treatment requires lifelong insulin therapy to manage sugar levels. Typically, it's diagnosed in childhood or adolescence. However, it can be diagnosed later in life as well. Type 2 diabetes is also known as non-insulin dependent diabetes. Its cause is a combination of insulin resistance, where cells don't respond well to insulin, and inadequate insulin secretion by the pancreas. Treatment often is managed with lifestyle changes such as diet and exercise and oral medications. Insulin therapy may be needed in later stages. It is more common in adults, although it is rising in children due to increasing obesity rates. Prediabetes is caused by when cells either don't respond well to insulin or the body doesn't produce enough insulin. It results in blood sugar levels that are higher than normal, but not high enough to be diagnosed as diabetes. This indicates an increased risk of developing type 2 diabetes, but can often be reversed with lifestyle changes like diet and exercise. Gestational diabetes occurs during pregnancy when the body cannot produce enough insulin to meet the increased needs. This leads to glucose intolerance. It is managed through blood sugar level monitoring during pregnancy. Treatment may include lifestyle changes, blood sugar monitoring, and sometimes medication. Typically, it resolves after childbirth, but increases the risk of developing type 2 diabetes later in life. Here you can see the incidence and prevalence of diabetes mellitus, as well as fasting plasma glucose levels and 2-hour oral glucose tolerance test levels. Here's a list of risk factors for both type 1 and type 2 diabetes mellitus. The pathogenesis includes a decrease in insulin, which leads to glucose in circulation not being used or stored, which leads to increased blood plasma glucose, which leads to the liver producing more glucose, where there is a continued increase in blood glucose. Clinical manifestations of type 1 and type 2 diabetes include polyuria, polydipsia, blurred vision, weakness, fatigue, and dizziness. Type 1 clinical manifestations include polyphagia, weight loss, and ketonuria. And type 2 clinical manifestations include neuropathic complications, however, can often be asymptomatic. Other complications include hypoglycemia, which is usually due to excessive insulin use. Clinical manifestations include hunger, sweating, tremors, palpitations, nervousness, tachycardia, headache, confusion, slurred speech, and dizziness. Hyperglycemia and diabetic ketoacidosis results from insulin deficiency. Clinical manifestations include thirst, polyuria, polydipsia, nocturia, weakness, fatigue, confusion, nausea and vomiting, chest pain, abdominal pain, and fruity breath in diabetic ketoacidosis, and a change in mentation. Here are the parameters for exercise and blood glucose levels. Here is a list of complications as well as complications with gestational diabetes. Other complications include atherosclerosis, cardiovascular disease, and neuropathy. Here you can see images of 2 different musculoskeletal complications that can occur. Dupuytren's contracture and trigger finger are both hand conditions that can be associated with diabetes mellitus. Dupuytren's contracture is a hand deformity that involves the thickening and tightening of the palmar fascia, leading to the formation of nodules and a thick band of tissue beneath the skin of the palms and fingers. Clinical features include palmar nodules or lumps, thickening and tightening of the palmar fascia resulting in flexion contractures of fingers, typically the right and little fingers. typically the ring and little fingers. While the exact mechanism is not fully understood, there is evidence to suggest an association between Dupuytren's contractures and diabetes mellitus. It is believed that local neurovascular changes and altered collagen metabolism in diabetes may contribute to the development of this condition. The inability to completely close the gaps between opposed palms and fingers when pressing the hands together in a prayer position, also known as a prayer sign, can be observed in individuals with diabetic flexion contractures. Trigger finger is also known as stenosine tenosynovitis and is a condition characterized by the inflammation and narrowing of the tendon sheath in the finger or thumb, leading to difficulty in smoothly extending or flexing the affected digit. Clinical features include locking or catching sensation in the affected finger, especially during flexion and extension, pain, stiffness, or popping sensation with movement. While trigger finger can occur in individuals without diabetes, it has been observed to be more common in individuals with diabetes, particularly women. The exact mechanism of this association is not fully understood, but may be related to the increased susceptibility of inflammation and tissue changes seen in diabetes. Other complications include adhesive capsulitis, also known as frozen shoulder, and diabetic ulcers. Education for individuals with diabetes mellitus includes self-management, visual skin inspection, wearing proper footwear, blood glucose monitoring, proper nutrition, and the benefits of physical activity. Here you can see exercise parameters for individuals with diabetes. Red flags for diabetes include polyuria, polydipsia, polyphagia, weight loss in the presence of fatigue and weakness, blurred vision or irritability, recurring skin, gum, bladder, or other infections, cuts and bruises that are difficult and slow to heal, and the presence of any cluster of 3 or more that require immediate report to the PT and documentation. Exercise contraindications for diabetes include poorly controlled blood glucose, unevaluated or poorly controlled retinopathy, hypertension, neuropathy, or nephropathy, recent photocoagulation or surgery for retinopathy, dehydration, and extreme environmental temperatures. PTA implications include blood glucose monitoring pre and post treatment, scheduling to avoid peak insulin times and periods of fasting, avoid injecting into exercising limbs. If exercising late in the evening, increased carbs may be required, and exercise when blood glucose is within proper parameters. Here's a list of endocrine and metabolic medications for thyroid disorders, bone mineral homeostasis, and diabetes medications. Here's a list of lab values in acid-base disorders, as well as reference values for basic metabolic profile and magnesium. Back to our question, a patient with hyperparathyroidism is being treated in an acute care setting. 2 days after the initiation of physical therapy, the patient complained of lower back pain. Which of the following could best explain the patient's presentation? A, multifidus strain. B, herniated disc, C, lumbar osteophytes, or D, vertebral fracture? The answer is D, vertebral fracture. If you like this video, please make sure to hit that like and subscribe.